Seshni, Moodliar on the phone, and we're going to be talking about what does the government mean when they say Freedom Day. So hello, Seshni, Dr. Seshni Moodliar.
Good evening, Valma James. Lovely to chat to you as always. And thank you for having me on the radio. It's so exciting to know, to be on today on Freedom Day.
Right. So what sort of day have you had? My goodness, it's been absolutely hot, and how are you coping with this weather?
Well, we've been enjoying the weather. The kids have been spending time outside and getting themselves hosed in water. We wished we had a pool. That would have made things a lot easier. But yeah, we've been enjoying the weather, and we went for a picnic in Coombs Hill in Aylesbury, and that was really lovely because it's a South African monument site for the Anglo-Boer War. Yes, so we went for that, and that was a nice day out, and also historical as well. We from South Africa, so still feeling very much connected, and feeling for everyone that's what's going on in South Africa. Praying that things settle soon.
Yeah. And so what's the monument before we go on to discuss Freedom Day? What's the monument about?
So it's the monument is actually written there on there South Africa, and it's for the Anglo-Boer War, and it's just a monument recognizing the people that participated in the war. So it's just basically a monument, and it's on top of a hill. It's absolutely a breathtaking view. So it's a lovely place to go and visit, to have a picnic. Yeah.
Was that the Boer War?
Yes, Anglo-Boer War. Yes.
Right.
Yeah.
Okay,
yeah.
That's interesting. So if there's anybody out there wants to go and visit, I'm sure they can find that on Google, couldn't they?
Yes.
So when the government talks about Freedom Day, what do they actually mean?
Yeah, I'm interested to know what you think. But Freedom Day, I think what they're saying is that we've obviously been in the pandemic since last year, and Freedom Day is now Boris Johnson, Downing Street, and the rest of the Parliament have now decided that it's Freedom Day because from today, a lot of restrictions have been lifted. And as you know, we've been in lockdown 2 or 3 times. I think 3 times we've been in total in lockdown. We've had severe restrictions from the pandemic, a first wave, second wave. Possibly we went through a third wave or going through a third wave. So today marks a milestone where they're saying Freedom Day is where we no longer are required to wear our masks. So I'm not sure how people are feeling, whether it's people are feeling happy about it, or whether they think that, it shouldn't be called Freedom Day, or that we should still be wearing our masks. But in addition to that, they've also relieved restrictions on pubs and nightclubs. So it's the first time where as many people as possible can go into a pub and have a meal without any restrictions, as well as go into a nightclub. So you must know this has been for a long time coming.
But isn't it causing a bit of confusion? On one hand, I was in the tube last night. I was coming back from East Croydon, and there was it was packed with young people who obviously came from Brighton, and they weren't wearing mask, but I was wearing a mask, and some of the people were wearing a mask. Isn't that going to cause a bit of friction where you walk where you go into a pub or whatever, you're wearing a mask, other people are not wearing a mask? Can't that cause some hostility? And confusion?
I think it is going to be, and to be honest, even though I said I'm excited, it's Freedom Day, I'm excited for whoever's excited that, you don't have to wear a mask. But at the same time, having said that, I work in a hospital, so I will be wearing a mask. Even when I'm going out, I will still be taking precautions. So like you said, it's going to cause some animosity. It's going to cause some conflict and friction amongst obviously people that are wearing masks or are high risk. Some people might be wearing a mask, Valma, because they just want to keep safe. They may have had COVID, or they may have had relatives that have had COVID and passed away, or they may have had or new people that passed away from COVID. So they want to be extra careful and extra cautious. They might also have underlying physical health conditions like diabetes, underlying lung conditions, and genetic conditions, immunosuppression, HIV, or any other conditions, that makes them a higher risk and are more vulnerable if they're pregnant as well. So there can be so many reasons why people will still want to wear a mask. And my opinion is that if you do want to wear a mask, you can still wear a mask if you feel safe. However, obviously, we've been given the go ahead. The government has spoken and they've said Freedom Day, and you no longer need to wear a mask. I think there's a lot of controversy around this, to be honest, Valma.
Most definitely,
yeah.
Yes.
Yeah. What are your views? How do you feel about it?
As you said, confusing because on one hand, you go out into the public domain, and some of us are wearing a mask, some of us are not wearing a mask, and I think last night before it was social distancing, which means you couldn't when you went on the tube or the train, you couldn't sit next to the next person.
Yes.
Now everybody's sitting wherever they can get a seat. So what's going on? It's confusing, absolutely confusing. You don't know whether you're doing the right thing, because some people, if you're wearing a mask, another individual as an observer won't know whether you're suffering from a long-term health condition, whether you're at risk. I mean, it's so confusing.
It is. I mean, that's what a lot of the headlines are, that it's confusion, it's chaos. So, I mean, what I wanted to say was that in terms of the like you said, you described your journey on the train. It puts people in a difficult position, people like you in a difficult position, and me, if we want to wear masks and we want to be extra careful. And what about the more vulnerable people, the elderly population, and the people that are high risk that I spoke about? It puts them in a really high risk, because how are you going to explain to the next person, what, I'm a high risk, I'm vulnerable, so it is going to be difficult. So I think there's a lot of confusion, there's a lot of controversy. And also, just to say, the figures in the UK are still increasing. We haven't seen the end of COVID. We know there's a South African variant, there's a UK variant, the Kent variant, there's variants from other countries, including the Lambda variant, which is now from Peru. So there's a lot of different variants, different strains of the virus, and the Indian variant, the Delta variant. So we are still not out of the woods. We still basically need to be cautious. And what we've heard and what experts are saying is the evidence is that the figures are still increasing. It's doubling every 3 weeks. So we are still seeing increased numbers. We're in the summer holiday. You described your train journey. It's like that all over England, especially with it being so hot. People are out and about. It's holiday time. People are socializing, traveling to different countries. Obviously, some of them would be isolating depending on the countries they've come from, because we have a red, amber, and a green list. So unfortunately, we are still going to see numbers go up. And on top of that, in addition, because we've made the changes, the government has now made changes of Freedom Day, I think it puts people in a difficult position, because it is possible that the numbers are going to increase significantly.
I was out with a friend the other day, and she showed me on her phone where apparently, if you're in isolation and you didn't do the 5 days, you can be fined. What's going on? People being fined.
Yeah.
I mean, and I mean, COVID test starts from £60 up to £100. Yeah. What's going on?
Yeah, I think it's still a concern, because the numbers are going up still, and obviously, like you said, people are concerned about the COVID, even though people have been vaccinated, Valma. So we've had, we've had the vaccine being rolled out. I personally have had my both vaccines. and my husband as well. So the vaccine has been rolled out. I know other countries, even South Africa. My twin sister called me today to say that they've had their vaccine in South Africa. So people around the world are still receiving their vaccines because it's still a concern, especially because of the variants and because of the different strains and the virus is mutating. So we are still not in the clear in terms of having not wearing a mask. To be honest, I would feel safer still wearing a mask, especially if I know the people I'm with. Then obviously I might not be wearing a mask. But for example, if I'm going to hospital, I'm going to be wearing a mask all the time, and we are required to wear a mask in hospital settings. I'm not sure how it is for you at work with your hospital as well.
Same here. We've got to wear a mask.
Yes. So yes, and I mean also taking in consideration children have not been vaccinated. So a lot of adults have been vaccinated, but not children. So what happens to the vulnerable clinically children who obviously are more susceptible to getting COVID? So it is going to be a concern. So there's a lot of figures, there's a lot of talk about the different vaccines and how much a percentage it does protect you against the COVID-19. So like 90% or 96% if you've had the Pfizer or the AstraZeneca, and if you've had other vaccines like the Johnson and Johnson. However, as we know, none of these are 100% effective. So the only way you can protect yourself is with obviously social distancing, hand sanitizing, washing your hands, and wearing a mask, which obviously at the moment they've now taken out. So from the beginning,
it's very difficult because if you're on the train, I mean, as I said, I was on the train last night, and it was packed. Well, every seat was taken up. People had to stand in the train, and people were pushing past. I mean, it's horrendous.
Yeah, I mean, it is really a concern. I mean, even Boris Johnson, I'm surprised he's made this decision. I respect the decisions. I respect the government, and I hope whatever decisions they're making, they are using obviously the best evidence available, the best figures and the research, and they are putting people at the heart and the center of what they're doing, like we do in the NHS and in private healthcare. It's about putting our patients at the center of it, and I'm not sure if that decision was made in that context, because obviously there's a lot of vulnerable people. Yes, there's a population of group that's obviously saying, yay, we don't have to wear masks, that's fine. But then there's a group of people that are obviously very upset, and it's obviously causing a lot of confusion and chaos. My advice, Valma, is continue to wear a mask if you feel comfortable. Wash your hands at least for 20 seconds. Use hand sanitizers. Maintain social distancing, and obviously wherever you are going, make sure you are on the NHS app so that you can check in and be alerted if there's any concerns. And if people haven't gotten vaccinated, if they are able to get vaccinated, if there's no contraindications, then please do get vaccinated. But Boris Johnson is saying, sorry, can I just say in the article that I've just read, that people that have had the vaccines are even catching COVID. So like, again, goes to the point that I've said, even if you do get the vaccination, it's not 100% effective, but it is better than not having the vaccination. If that makes sense.
And I'm just wondering, because I was looking at the World Health Organization, WHO, in terms of self-care for the month, 24th of June to the 24th of July, about self-care. How does this link into COVID? Is it something that the pillars, the 7 pillars that they've created, is about informing people about how to look after their health and well-being? I don't know if you've seen it.
Yes, I have. We had a discussion about this. I have. And I think it does link in with the 7 pillars of health and well-being. And self-care is so important. We've seen that in the COVID-19, especially with people getting unwell and getting ill physically. And then having a surge, a tsunami of mental health conditions, as we've seen in mental health, the both of us working in mental health. So self-care is really important. So as much as we are taking care of our physical health, where we are eating healthily, exercising and drinking plenty of water, having enough rest, and ensuring that we're taking vitamins or whatever medication that we need to take to keep ourselves healthy, managing our sugar or whatever physical health illnesses that we do have. taking care of our overall mental health and well-being is really important. And then in addition to that is self-care. And I for one, and I'm sure you are an advocate for self-care. Taking time for yourself is so important. And I've been trying to do that as well, because what can happen is, because of the busyness of our lives and the changes, and what we are faced with on a day-to-day, never in a time in history have any of us have faced what we are facing now. We've had to get through so many different lockdowns, go through online work versus being in the offices, being in isolation, having to juggle family life as well as our work and careers. So a lot of people have been placed with extra additional roles and responsibilities. And a lot of people are feeling overwhelmed and not able to cope with day-to-day things.
Yeah, I was thinking about that, Seshni, because, the hot weather's here. People, is there any research in terms of how this hot weather is going to impact on COVID? Does it make it easier for people to become contaminated? Is there any research? Do you know if any work's been done around that?
Well, you remember in the beginning of, that's a very good question. In the beginning of COVID, we know that certain countries were on the spotlight because obviously when the UK, if you remember, we had a surge in March months. So February, March, when we started actually with the pandemic. It started in Wuhan, China in December, but obviously in our cold winter months, we started to see an increase, thousands of people getting infected and then dying because of COVID in the first wave, and that was in the winter months. So, and then looking at the same time in South Africa, we know that whilst we were experiencing a pandemic in the first wave, they were not experiencing anything because they were in the summer months. So definitely there has been research and there is research into it. I don't have the up-to-date figures, but what I can say is that we know that in the summer months, there's definitely a less chance of the virus actually surviving. So that was the studies that were done. Right. However, that's not to say that obviously we don't have the virus going around. So it's not to say that because it's a warm weather, it's hot, that people are not going to get infected, because as we know, the figures are there. People are getting infected and they are getting COVID, and some people are dying, or some people are getting it seriously and then having long COVID symptoms. So it's I wouldn't go. I think I wouldn't go on the weather itself. Is that the answer you wanted? I'm not sure.
Yeah, well, it's just that individuals might be thinking, okay, it's the hot weather. How is COVID going to contaminate other individuals? There's the hot weather, as you said. There's some research. Maybe we can get you on to look at some of the research that's out there around COVID. I'd just like to say thank you so much for taking the time and creating a bit of awareness about what the Freedom Day actually means and how we can take care of ourselves.
Yes, I mean, one way I think we can.
It is very challenging, and I could well imagine it's going to arouse some ill feelings.
Yeah.
When you go to a restaurant and somebody's not wearing a mask and you're wearing a mask.
I think it's just, it is going to, but I think we should embrace Freedom Day, but at the same time take precautions to, as I've said from the beginning, protect yourself, protect your loved ones, protect your community, because at the end of the day, every life matters. Economy and all these other things can be rebuilt, but we can never get lives back. So take care of yourself and your loved ones. Thank you so much.
And stay safe.
Yeah, you stay safe, and let's spread the love and not the virus. Thank you, Valma.